The COVID-19 relief bill passed by Democrats in Congress last March had $112 million to bolster childcare in Montana. But as of this week, the Gianforte administration has yet to distribute any of the money to childcare providers, although hundreds have applied for it. Here's what's going on. Last fall, the Gianforte administration committed $31 million of this federal money for childcare stabilization grants to help providers across the state. When more than 400 providers applied, the administration decided it should add another $30 million to the pot, and 2 weeks ago, a legislative commission endorsed that request. State Public Health and Human Services Director Adam Meyer said grants would total 45% of a child care provider's operating expenses for 2022, but only after subtracting the amount of COVID relief money they got the previous 2 years. The state also says it's still reviewing applications and that initial payments should go out in the coming weeks. Some child care providers are not happy with the state. At the commission meeting 2 weeks ago, Elizabeth Schultz of Learn and Play Childcare in Belgrade said grant information and amounts as told by the state have been constantly shifting.
What was told to us with so much excitement and enthusiasm has led to nothing but disappointment and a complete loss of trust in the DPHHS.
4 Republican lawmakers on the commission voted against spending the additional $30 million, including Representative Terry Moore of Billings.
I just am troubled that there are virtually no priorities about how these funds are dispersed. And it's just simply, for all practical purposes, based on an allocation of expenses and not, frankly, on where is the highest, best needs for the best outcomes in Montana.
The commission chair, State Representative Frank Garner of Kalispell, also a Republican, said there must be clear expectations on how the child care money goes out, but he provided the swing vote to endorse the increase.
I think it is so critical, such a critical need right now, that I don't want to delay the ability for us to get this money out into the field.
I also talked to Valerie Reigard, the director at Just Like Home Daycare in Helena. She said once Just Like Home finally gets its grant, she may use it to benefit their staff, such as covering more health insurance costs or contributing to their retirement funds. Across the state, child care providers say hiring and retaining staff is their biggest concern and a primary reason why Montana faces an ongoing shortage in affordable child care. And the other $40+ million in the COVID relief bill for Montana child care? The Gianforte administration says it's working on a plan to spend that money to help child care providers bolster and sustain their businesses. Reporting from Helena, Mike Dennison, MTN News.